Am I audible and is the slide visible to everyone? Yes. Okay. Okay. It's 9 o'clock. We'll start. Okay. So that will finish on time. Okay. Let's start with the first MCQ. Okay. Which of the following conditions can result in a hairy patch on the back of children? Okay. A is epilepsy. B is rickets. C is spina bifida occulta, and C hydrocephalus.
C. Spinal bifida occulta.
Yes. Answer is, as everyone is saying, it's spina bifida occulta. Okay. Okay. So let's continue with the assessment. Okay. We finish with the skin. Okay. Now we'll go with the head. Okay. As we all know, this is the fetal head. Okay. We have the different sutures. Okay, we have the sagittal sutures, we have frontal sutures, we have coronal suture, we have lambdoidal sutures. You will do this in the I think you'll do this in detail in the OBG class, but just to cover up, okay, just for us to remember. Okay, and then we have questions have come from the like regarding the sutures, regarding the diameter. You have to be very well versed with that. Okay, then here we'll cover only the fontanelle. Okay, so you have to know the like how many sutures, how many fontanelles are there, how many bones on the fetal skulls are there, then like when do they close and all like that. Okay, so we have how many fontanelles do we have in a fetal skull?
2. 2 fontanelle.
Okay, we don't have 4 fontanelle. Like can anyone else guess? Okay, we have around 6 fontanelles. Okay, 6 fontanelle, but for exam point of view, only the anterior fontanelle and the posterior fontanelle is important. Okay, but for us to know, okay, we have 6 fontanelle. Okay, we have the anterior fontanelle and the posterior fontanelle. Okay, then we have 2 sphenoidal fontanelle. Okay, on either side. Okay, on the left side, on the right side, we have 2 sphenoidal fontanelle, and then we have 2 mastoid fontanelle. Okay, on the right and on the left. Okay, so in total we have 6 fontanelle. Okay, so is everyone clear? We have 6 fontanelles. So these fontanelles, they are space between the bones of the skull in an infant or fetus where ossification is not complete. Okay, means the bone ossification have not get complete in these fontanelles. That's why they are space between the sutures. Okay, questions have come like anterior fontanelle is present between which sutures or between which bone. Okay, so you have to be well versed in that. Okay, suppose the anterior fontanelle is present between the frontal suture, the coronal sutures, and the sagittal sutures. Okay, otherwise they can ask like between the frontal bone and the two parietal bone. Okay, like that. So we have the anterior fontanelle and the posterior fontanelle. These are important. These two are important in the exam point of view. Okay, anterior fontanelle, as we all know, it's a diamond shape soft spot located in the junction of the frontal and parietal bones. It is the largest fontanelle and typically closed by 18 to 24 months. Okay, this is important. And posterior fontanelle, it is smaller in size to the anterior fontanelle. It is triangular soft spot at the junction of the occipital and parietal bones. It usually closes 2 to 3 months after birth. Then we have 2 mastoided fontanelle, right and left, location between the temporal, parietal, and occipital bone, okay, behind the ears. Okay, you see this one, okay? This is the mastoidal fontanelle, okay? Shape is, it is irregular and closes around 6 to 18 months, okay? Then sphenoidal fontanelle between the frontal, parietal, temporal, and sphenoid bones near the temples, okay, here, okay. Then shape is again irregular and closes around 6 months. Okay. Then suppose if the fontanelles are large, okay, large fontanelles, if we assess and we see that the fontanelles are large, we have to know that the baby might be associated with conditions like hypothyroidism, osteogenesis imperfecta, and all, so that we can do assisted tests. Okay, but we have to assess first whether the fontanelles are appropriate in size or large. Okay, if bulging fontanelle may be due to increased intracranial pressure, meningitis, okay, or hydrocephalus. Then depressed fontanelles may be seen in with dehydration. Okay, as we all know, like if the baby is suffering from diarrhea, we can like depressed fontanelle is one of the clinical manifestation. Okay, then a small fontanelle may be due to hyperthyroidism, microcephaly, or craniosynostosis. Okay, so these are regarding fontanelle. Okay, then coming to the molding. Okay, molding is during the head first birth. Okay, that means when the head is going through the delivery canal. Okay, through the during the delivery, when the head is going through the vaginal canal. Okay, this head, we all know that the ossification of bones has not started. Ossification means the hardening of the fetus skull have not been completed. Okay, so because of the presence of these suture lines, the head can change its shapes. Okay, the head can change its own shape, and it can navigate itself. It can make space for itself inside the vaginal canal. Okay, so that is called molding. Okay, so during the head first birth, pressure on the head caused by the tight birth canal may mold the head, okay, into an oblong, rather a round shape. Okay, that is called molding. Okay, question have come from here, like they will give the definition and they will give the options. Okay, so your answer will be molding. Okay, so newborn head molding is a common occurrence that usually disappear within a few days. Okay, so if we find that the newborn head, if the newborn has been born to a patient with normal vaginal delivery, and if we find that the newborn head is slightly elongated, we have to think like it can be because of molding and all like that. Okay, but these are self-corrected. Okay, we don't have to do anything, we just have to do conservative management. Okay, coming to the carpet succedaneum, we all know, we are very well versed with this one, and question have come from here. Okay, question have come from here. So what is carpet succedaneum? It is a swelling of the scalp of the newborn. Okay, this is the scalp of the newborn, the swelling. Okay, swelling of the scalp of the newborn. Okay, it is often brought by the pressure from the uterus or vaginal wall during the head first vertex delivery. Okay, so during suppose if the head is being born first. Okay, if it's a vertex presentation, this baby can form a swelling under the scalp. Okay, swelling under the scalp, it is carpet succedaneum. This swelling, it will clear up on its own within a few weeks. Okay, so it's under the scalp, this carpet succedaneum. Okay, then we have Kefal hematoma. Kefal hematoma pada newborn with Kefal hematoma, it's a build-up of ruptured blood vessel in the periosteum, which is the tissue that cover the skull. Okay, so so this is the periosteum. You see, this is the normal side of the fetal skull. Okay, we see this periosteum, and here, because of the rupture of any blood vessel, because of the traumatic delivery, different cause. Okay, it can cause a rupture in the blood vessel, in the periosteum. Okay, so if there is accumulation of blood, okay, hematoma, if we say hematoma means there is something blood. Okay, cephalom means accumulation inside the periosteum. Okay, you see the carpet succedaneum, it's under the scalp. Okay, the periosteum, like above the periosteum. Okay, while here it's the in between the periosteum. You see, can you appreciate it? Okay, so that is one of the difference of the between the Kefal hematoma and the what is that carpet succedaneum. Okay, in a hematoma, the blood pools outside the blood vessel and is visible on the baby's scalp. The pooled blood puts pressure on the brain tissue, which can lead to fatal complication or lifelong disability if not immediately diagnosed and treated. Okay, however, this is not treated on its own, it will get resolved. Okay, we just have to see for the if the condition of the baby will worsen or not. Okay, then coming to something called as subgaleal